Hello again, this is Dr. Tony. I am the host of the Crooked Spine Show in Southern California. Dr. Pecoraro, is that correct?
Yes,
Good,
that's good.
perfect. He is in New Jersey. We're on East Coast, West Coast time today. So we're going to talk about exactly how to realign your spine for peak body performance and understanding. He'll talk about a certain technique that you may not have heard of, that he's gone into practice again, which we'll talk about. We practiced before having 5 clinics in New York, and now practicing in clinic specializing in EPIC Realignment performance through sound waves also, so you understand that and how that works as a way to get yourselves healthy. We all want to see or understand how chiropractic works, right? There's so different techniques out there. We have to figure out what doctors we go to and what do they specialize in and how are they competent in technique. And using Dr. Pecoraro's experience for a long term, he's been practicing as long as I have, a little bit longer maybe. At that point, the knowledge experience combined allows you to use certain techniques to make your body healthy. So Doctor, tell me what's going on. How do you get into this? What were your practice before, and why did you come out of retirement to start your practice now?
Okay. Well, first of all, thanks for having me on. I really appreciate it because I want a lot of people to know about this technique. I practiced the first 5 chiropractic for many years. I started in 1980, and in 2005, I retired. And then a few years ago, one of my daughters hurt her low back, and she was only 30 years old. Nobody could help her. I sent her to all different kinds of chiropractors, to acupuncturists, to medical doctors. She did all kinds of treatments. Nothing helped her. I was actually about to figure nothing could help her. Someone told her about this chiropractor who had a practice about a block from where she lived. So I went with her. He explained about the atlas, which is the top bone in the spine, and how if it's misaligned, it could throw the whole balance of the body out. So she got the treatment. Before, she couldn't walk. She could hardly drive a car. She couldn't carry anything. And after the treatment, within 30 minutes, 70% of her pain was gone.
Wow.
So that intrigued me, and I started sending people from New Jersey down to Florida, and the same type of thing. People who couldn't get help otherwise through chiropractors or anybody else would go down there and get these miracle type of cures. So I decided to get back into practice, learn the technique over the last 3 years. And then EPIC became a franchise. I opened the first franchise. And that's how I got into it. I was very intrigued by how effective it was.
Well, at that point, you understand how chiropractic works. You've done it for a long time. Even though you're retired, you never really lose that art form, for one. You understand that knowledge and communicate how chiropractic works. How is EPIC basically different from traditional adjustments chiropractic? How would you describe that? What's the similarities and differences?
With EPIC technique, it's a little different because we concentrate on aligning the atlas. Now, once we align the atlas, everything else seems to move easier. So the protocol is to find out how the atlas is misaligned, and we use this specific technique where we analyze the x-rays to find to the millimeter and degree that the atlas has displaced. And then we input it into our machine, and it goes through 3 axes, the X, Y, and Z axis. The old advanced orthogonal or atlas orthogonal just went in one direction. So this is more specific. And the sound wave the patient doesn't even feel the sound wave, but it will move the atlas back in place. And we take a post x-ray immediately after the adjustment, and we analyze the x-rays again using our spinal engineering software to ensure that the atlas has been corrected. Now, once it's been corrected, as long as it's in place, the body will start to heal. What happens, though, later on is sometimes the pelvis and low back can go out of place, and then we use diversified technique in that area or activator or a lot of different things like that But the main protocol is to do the atlas first. And what I found when I was practicing before, if someone had a low back problem or in other parts of the spine, that it took a long time to correct it. Where with this technique, it seems so much quicker and people are much more stable. So I have a lot of patients that have gone to other chiropractors and they really like their chiropractor, and they come, they get the treatment, but then they go back to the other chiropractors for the other parts of the spine, and it works out really well for them.
What I like is that you had mentioned with the protocol, it's taken pre-X-ray, see what's going on there. At that point, figure out with the computer analysis the three-dimensional image of the actual atlas, really sitting on top of the axis, along with being compressed by the occiput, by the skull. Exactly treating that with, and I'll have you explain sound waves, how that works. Then taking a post X-ray so you compare the results. So it makes, for my mind, it would make it more valid because you're seeing the diagnosis off of and fixing that diagnosis and seeing the exact results.
Yes, that's very impressive because when we treat the person with the sound wave, the stylus that emits the sound wave doesn't even touch the skin of the patient. And when we do it, the patient doesn't even know anything happened. And they'll say, "That's it?" And we say, "Yeah." But then when they see their post X-rays, they're very, very impressed with it, as are the doctors that use it.
What the heck?
Yeah, they say, "Oh, you did something," but then the next day they'll come in and say, "Wow, all this stuff happened, and my neck feels longer, and I'm standing straighter, or I slept really well, and my headache's gone," and all these different things, which is very exciting. Because a lot of patients also don't like their diversified, where you twist the neck and you hear popping and cracking. Some people like that, but a lot of people are very afraid of that. So, or especially if they're in a lot of pain, it's hard for you to adjust the other way. And this way, since they're just laying on their side and you're putting a sound wave through, it's like very non-invasive.
And go back to how does a sound wave work for someone that has no idea how waves work, wavelengths work for 1-2 vibration? How does that work to move the bones and get things to realign to better position?
Well, people don't realize, but sound waves are used in medicine all the time. In fact, they use it to kill cancer cells. They use it to break up urine stones, like
gallstones too, correct?
Yep. And in the bladder. And also by hearing, you have bones in your inner ear that they're moving. Once the sound hits the eardrum, it moves those and they stimulate the nerves. So sound waves can move things. If you've ever gone to a concert and you were close to one of those big speakers, you could actually feel that. Another thing is sometimes you see in movies where there's an explosion and somebody's like 30 feet away and they fall over. It's from that sound wave coming. And so sound waves do move things, but this is a very gentle sound wave, and it just moves the atlas within its normal range of motions. So there's no stretching of the muscles and ligaments, where sometimes diversified techniques or other techniques can loosen up the muscles and ligaments and cause a problem for the patient.
Well, I can see that too, especially when, like you said, acute pain, whiplash accident, trauma for 1-2. That when those muscles and ligaments are so tight and guarded and inflamed, even just touching the skin can cause someone to jump and guard. So I could see that huge benefit. When did this technique or this machine actually come into effect and come into, I guess, become chiropractic?
Well, actually, the first machine was made in 1980 by Dr. Sweat.
Okay.
He's the person who developed Atlas orthogonal. The way to analyze it actually was started with Dr. Grostic in the 1930s. But it was found that you didn't need as much force to move the atlas. Before, like with BJ Palmer, he would really put a lot of force in the patient. If you've ever seen videos of it, you think that he was going to take the person's head off. But in 1980, Dr. Sweat developed this idea with other chiropractors do upper cervical, where you don't need as much force to move it. So he developed the sound wave. And as time went on, at that time in 1980, there wasn't the technology to go through all the different axes. So Dr. Pierce, who was a student of Dr. Sweat, about 10 years ago, he started to develop this new machine with new technology where you could be more specific and more points of view to get it back in place. Another thing Dr. Pierce did was he took some things from another technique where not everybody's atlas is formed the same way. One side may be higher than the other. And so he takes into consideration with the analysis 24 different anomalies that occur. There's still other ones that he's looking for. So if someone with atlas orthogonal, you want if you drew a line through the middle of the head and along the atlas, you want it to be 90 degrees. But if you have an anomaly in the axis, the second bone in the spine, and the atlas, and with the occipital condyles, that would be wrong for some people. So we get some people who, they have a head tilt, but that's okay for them. And if you try to make it the other way, it causes problems.
I like that because you're not only worried about the one bone, but also the bone above and below, the occiput meaning the bottom of the skull, along with the atlas meaning the bone below. So that combination of joints together works as one complex to make the body move properly. And with that too, affect nervous system, affect your quality of life, everything, correct?
Correct. And, by the atlas, there's so many blood vessels, the internal carotid artery, the internal jugular vein, which is blood supply to and from the brain. There's the vertebral arteries in the atlas, which make a 90-degree angle to get up into the brain. So we have a lot of people come in and they say, I have brain fog, or, my head feels heavy. And after the treatment, it goes away because now you get normal blood flow. You also have the glymphatic system, where you have the cerebral spinal fluid going in and out. And if the atlas is misaligned and the rest of the cervical spine is misaligned, then you're not going to have the in and out flow, and you could get waste products just stagnating around the brain. So, and since the brain controls everything and everything goes down and to the rest of the body through the nerves, then you could have all kinds of problems.
It's almost that area is your channel, if you want to call it your main cord or wiring system, and nerve flow, blood flow to your whole body, correct? Up or down?
That's correct. And, some of the things we've seen that, I never had seen before was people with a blind spot in their eye that goes away. No doctor could see what was wrong with them. Trigeminal neuralgia going away with one treatment. What we've had is a lot of people with jaw pain, problems with jaw pain, and they've been to 7 different doctors, dentists, specialists, and by adjusting the atlas, because you have the trigeminal nerve supply there going to the muscles in the jaw, people are having all these problems. And if you adjust the atlas there, then everything evens out and they no longer have problem with their jaw. People have come in where they couldn't eat a corn cob, and then afterwards they were able to open their mouth and do it. People who couldn't eat hamburgers before because they couldn't open their mouth enough a lot of these things tend to clear up.
Well, it's amazing how in the chiropractic world, even functional medicine too, we're looking for the root cause of the problem, not just treating the symptom of maybe jaw pain, facial paralysis, for one to even eye problems. Also, find the root cause is sometimes, like you had mentioned, coming from the source of the nervous system, being from the atlas, the occiput, and the axis, a combination of joints and motion. Correct?
Correct. What really was interesting for me was how much the atlas controlled the muscles in the low back and the balance of everything. Because you have the muscle spindles in the muscles that connect the atlas to the occiput. And if one side is stretched compared to the other, you get, signals going into the spinal cord up into the vestibular nucleus, which is part of the brain that tries to balance your head over the middle of your body. And so if it's sending the wrong signal, you'll have spasm in one side of the low back as opposed to the other. And then the discs can wear out over time. And you have people with sciatica, like what happened with my daughter and several other patients. And we've had a few patients here where they were told you definitely need surgery. You're going to lose the control of your bowels. And we gave one treatment, and within a couple of weeks, everything was cleared up. So these are the kinds of very interesting cases we've been seeing with this technique.
It's amazing too, in the sense where I'll see someone that has, because I take x-rays in my office also, that has a lengthening quality. The hips may be off, the hips may be rotated, unlevel for one too. But if I'm seeing that, I'll go, I want to treat that lower back, maybe help the connective tissue rebalance themselves. Like you said, if that's not the cause of the problem, it may be coming from an actually imbalance of nerves from the brain down to the actual lower back. I want to call it just bundle of nerves to make the body stay off of balance, correct?
Correct. And it's very important too, because some of these people who have low back pain have had it for so long that once you correct the atlas and you rebalance the spine, a lot of the pain can go away, but some can stay because it's musculature, because muscles tend to atrophy over time and things change. So physical therapy is needed sometimes, muscle work is needed sometimes, and again, adjusting the lower back is needed sometimes. But again, before, when I had people with lower back problems, they would be coming 3 times a week or 5 times a week in the beginning for months to get them to the point where they were really stable. But with this technique, I found we adjust the atlas, it balances everything, and someone comes in and say, oh, I have a little, I can feel it in my low back, and I adjust them with the activator in their low back, and then that's good. Then they don't need to keep coming back a lot. So that's what fascinates me.
I think it helps you exactly. It makes you find the source of the problem, may be the atlas. At that point, everything else can kind of trickle down to make it a secondary condition, which over time will, like you said, correct itself if the main source of the problem is gone.
Yes, that's correct.
Actually,
I'm sorry. Go ahead.
Do you fix also? How does it affect the emotional imbalances with scoliosis? How would that affect someone with scoliosis where their spine is twisted, especially in someone who's younger or even sometimes older?
Well, it depends on the type of scoliosis. If the scoliosis is due to an imbalance in the spine, we can see sometimes we'll take a before x-ray, they'll have a scoliosis, we'll take it after, and you'll see it had straightened out immediately. Now there's what they call idiopathic scoliosis, where you're not going to get rid of it, but you can take pressure off certain areas because it's you get that side bending. It will cause some problems there. So the adjustments really work really well with that too, just to make the person feel better.
It's almost like I tell some patients, hey, you're 35 years old, so you're not 21, your bones are done growing, but can we minimize, like you said, your scoliosis so you don't feel like you have scoliosis? Symptoms are reduced.
That's correct.
And with that too, do you help a lot of young patients? Is it for older patients? What's your demographics for this technique?
we actually have had patients all different ages. A lot of young people who are working, a lot of young mothers who have
Hmm.
children are constantly picking up their kids and everything. We help a lot of those people. A lot of people, older people who have problems that have been brewing over a long period of time. Very often, will during the consultation, they'll say, "Yeah, I have this problem in my jaw, and it just came on like 6 months ago. Went to see all these doctors. The dentist couldn't find out what was wrong. They wanted me to use a piece while I was sleeping in my mouth." And then when you question them, maybe 20 years before, they had a car accident. And it was just a little thing, and it didn't really bother me. I had a little stiffness
Mm.
for a few days, and that was it. But then when you take the X-rays, they have a loss of the cervical curve, or arthritic changes and things like that. So it's something that builds up over time. That's why the atlas is so important. If you're imbalanced, like for one side, your disc is going to start to wear out on that side, over time. Or if you're imbalanced, you could get problems in one knee and not the other. And a lot of doctors will say, well, that's because you're getting older. But then you say, well, isn't that knee the same age as this knee?
Exactly. Give me my copay back, doctor.
Yeah.
And with that too, going to medicine, this being in somewhat non-traditional technique, how has medicine or medical doctors or even from patient feedback, how have they kind of accepted or debated this technique with you, or how does that work with your medical, I guess, colleagues?
Well, I do have a brother who's a surgeon. He is actually became a patient because he was all
Mm.
twisted to one side he kept doing the surgeries, and he got chiropractic adjustments, acupuncture. Nothing was helping him. So I sent him down to Florida before I was trained. And within a couple of days, he was fine after being like that for like a month or so. So he believes it just depends on the practitioner. We had some patients who would tell their doctor and they just like think it's mental or something like that.
Magic, just magic. It's amazing how medical doctors will not say, I don't know, let me find out what it is. Let me ask some questions versus, you don't need to worry about that. If you take some more pills, you'll be fine.
Yeah. Yeah. I
Amazing.
mean, sometimes I'll have a patient come in and I'll do a consultation, and the patient will tell me all these things, and I'll ask a lot of questions. And I said, well, what did that doctor do for you? He said, and we just started talking like 10 seconds ago. He said, you've already taken more time with me than the doctor.
And it
So,
should, but it's amazing how that's no longer the standard of care, correct? It should be.
mhm.
Amazing. And going back to, okay, now we have someone that is getting better and is improving with your technique, maybe referring out for normal chiropractic, maybe physical therapy, other things too. How does it relate to causing body peak performance with overall chiropractic and or EPIC realignment?
Okay, well, if you're an athlete,
Mhm.
and you're off balance a little bit, it's going to affect you.
Good.
I think there was one study with upper cervical that showed that I think it was I don't know if it was major league pitchers,
Okay.
but baseball pitchers would get more speed on the ball
Mm.
once they got an upper cervical adjustment. So it's got to affect you a lot. Like if you're a runner, you're a football player, you're a baseball player, basketball player, it's got to affect you if you're slightly off balance. And if you're in alignment, you're not going to get the knee injuries, the hip injuries, the foot injuries. All those things are going to you're going to be less prone to get. So, and also with the brain, when we're talking
Mhm.
about the brain before, the flow of blood to the brain and away from the brain, if that flow is good and you have good brain health, you'll be able to react better. And so your performance is going to be much better. A lot of athletes have found that.
What's amazing when you talk about tweaking the little things, it's with that little bit of more energy or coordination or fast twitch muscle, that reaction time. allows you to become that next level athlete. Maybe high school, college, or even at the pro level too. But even just living normal daily life, I'm assuming I can now be a weekend warrior, someone who works out daily to stay physically fit and not have injuries also.
Exactly. I mean, I had one patient, he was 74 years old. He had pain in his hip on the left side, his knee on the left side, his ankle on the left side, and also pain in the neck on the left side. And he wasn't able to walk for more than 5 minutes. So he would walk around and then he'd have to sit, and he just never could walk that much. So after the treatment, within one day, all the pain was gone in his knee, his hip, his ankle, just adjusting the atlas. And the next day, he was going with his granddaughter, walking 5 hours, no problem.
It's magic.
So,
It's just magic, Doc. I don't know how else you would call it. Just magic.
yeah, exactly. But being
It's not only
chiropractors,
the physical, it's all the physical, it's also the mental, correct? It's not once someone has that motion back, they're pain free, they can do their normal day. How does it affect them? And we know, but how would you say someone who does not see a chiropractor before, how's the emotional transformation with that type of motion or movement?
yes, well, it's a good question because it was very personal for me with my daughter.
Yep.
She thought her life was over. She was 30 years old. She said, am I going to be like this for the rest of my life? I can't get out of bed. I have to sleep all day or lay in bed all day, or else my back will hurt if I sit for too long or if I walk. So she was very, very upset emotionally. Once everything was corrected, now she's got a normal life. You never even, she used to complain to everybody in the family. She would call everybody up and complain every day because she was in so much pain and she was worried, you know. So after this started happening, and it happens with a lot of patients, they thought this was it because they've gone to doctors and they weren't getting them better. They thought they had to live with it. And then once they get better, it's like a new life for them. You know, just like I had this patient with trigeminal neuralgia. He had it for 18 years. It was getting worse and worse every year. He said he would be walking with his wife. The pain would come on. He would have to stop for like 10 minutes just to fight the pain. Now, there's no pain. He comes in, he's so happy. He's, you know, he retired and then he had this terrible pain. He said, I retired for this, you know, now I have no life. And now he's just so happy. He's living life, enjoying his retirement.
It's amazing when you get to someone when they've been chronic pain, whatever it might be, they sometimes go into an anxious or even depressed mode, how it affects them not only physically and mentally. So when you reverse that, you see that confidence come back, boom, they're back. Now they can do more. Now they can actually live a normal life. They can work, they can play, they can have fun with their families. Like you said, they'll call now instead of saying, I have all these problems. Hey, how are you doing? I'm doing great. What else you want to do? So when you see that mental change, I think sometimes, Doc, is what I'm looking for to get to the next level so their quality of life now can improve by doing more things to actually live a normal life.
Exactly. And I think that's what people want mostly. You say,
Yes.
well, what do you want? Say, well, I want to be normal. You know, they want to be normal. I mean, I had it also, one of the patients I sent down to Florida before I was trained was my nephew. He was 28 years old. He had back surgery and he was laying in bed all day. We would be going out to dinner. We would go 2 blocks in the car and he said, I have to go home. I'm too much pain. I mean, now it's a couple of years later. He's going surfing every day. He's lifting things. He shovels snow during the winter. I mean, he thought his life was over, and now he's like living a normal life.
Well, it's amazing when you see that quality of life improve, how it trickles down to not only them but also their family members get the benefit too, and they're even coworkers too. With COVID, the last couple of years, people being home more, being work from home too. How has EPIC Realignment helped them with their daily lives?
Well, Atlas being aligned
Mm-hmm.
helps everything.
Mm-hmm.
I mean, you know that if the nervous system is working properly, the body has an innate way of healing. and making you feel better. So if the atlas is out, there's a degree where you may feel a little not so good or a lot not so good. So we've had patients who had COVID and they were told, oh, you're going to have like this brain fog for the rest of your life, or you're going to have this feeling for the rest of your life. And it's not true, because once the nervous system is in alignment and working properly, then your body heals itself.
What's amazing talking about the COVID being if you want to call it a virus, you remove that, then the body, like you had mentioned, has a self-healing process. So why not let it work properly, but more efficiently by causing more motion in the body, especially the atlas, so the body can actually get to recover faster and move things better too, versus like you had mentioned, stay home, take medication, don't move. That's going to make things worse.
Exactly. I mean, I remember having COVID. Actually, the first couple of years I didn't have it, then I got it. And I was having trouble, breathing a little bit. So I was told, yeah, you got to rest, I said, no. I went out and I walked every day, and it just went away. I mean, that loss of breath just went away by having your body moving, because movement is life. When there's no movement, there's no life.
And we move more, there's more blood flow, more circulation, so then our body can actually use the nutrients we're feeding it to make the body recover on its own, versus, like you had mentioned, the opposite of now we're going to take longer to recover because we're not moving enough. Now we're doing more things at home and more brain fog. I had COVID in January this last year. It took me about 4 months to recover because I've had other health conditions too. So the breathing was labored. I had some brain fog. My wife says I still have brain fog. I'm not sure if that's true or not, just her own opinion. Well, a lot of it is, can we move our body enough, like you mentioned, and help patients move their bodies enough too, so they can get themselves healthy and maintain that. With EPIC Realignment, you mentioned, I mentioned with Mallory, there's about 3 franchises now, or is there 2 franchises? You and somebody else?
Well, there's the original office, Dr. Pierce's. There's an add-on franchise. Like if you have a practice already, you could learn this technique and have it part of your practice. There's my office, there's an add-on franchise, and there's the initial founders franchise. So, and there's a couple of more that are supposed to open within the next year or so.
Anything West Coast, or we're still uncivilized?
No, nothing on West Coast yet. It's basically just Florida and New Jersey right now.
Is it state approved, or how does that work with, say, not even billing, just overall licensing, things like that? Or is that basically part of just the chiropractic realm?
Well, we're actually a cash practice. We don't take insurance. One of the reasons is because the insurance companies and the patients will decide how often they come and when they need to come. And that's really not the protocol. You need to come when you need it. And we don't want the insurance companies, third party, who don't know anything about the patient, to determine what the patient should get. And also the patients are like that. They'll say, well, my insurance covers. If it's not covering anymore, I don't come, even if they need it. So we've decided to have a cash-based practice. But I have to say that people don't have to come as much. So in the long run, it's actually better financially.
And people will pay for quality of life. Come on. They pay for the gym. They pay for medications, makeup, everything else too. They'll pay for quality of life. I have my practice is basically half cash, half insurance, a little bit of PI here and there, no work comp, no HMO. When you have a good quality, if you want to call it communication with your patients and your community, I think that's really all it takes.
Yes, I agree. And it's like the patients that you get these results with, they never regret having to pay for what they get. Especially some of these patients who've been to, a bunch of other doctors, haven't gotten better, and then you come up with a treatment that all of a sudden they get better, and they thought they were going to have to live in pain their whole life. It's, you can't even pay enough for that. It's like you said, your body's better, you're healing, and your quality of life is increased. And if
you're 50 years old, you have another 50 years to go. why wouldn't you want the 50 years being better? I heard something to where I lived to 50, but they buried me to 85 because their quality of life just was not where it should have been.
Right.
So that regret of paying even $10,000 now to live a normal, healthy life, to go on vacations, to go to just to dinner, like you mentioned with your nephew, just be able to go to dinner with pain free. It's priceless when you talk about that type of stuff.
Exactly. So people who come, they get the results, they're very happy uh,
Good.
with paying for what they get. And basically, I mean, we're much cheaper than they have spent already on other things that didn't work. You know, and
I don't even care what the price is because your quality of life is better.
exactly.
You're not dragging people in that are going to use their Medicare card for this type of care. No, they
Right.
understand quality of life. And being a seasoned doctor too, Doc, I was going to ask you, what are characteristics that help you really, if you want to communicate and care for patients? I have a lot of interns and future chiropractic students wanting to getting to private practice, communicate with their patients better. What do you use, or what do you would say your top two or three that you really enjoy with working with patients, how your communication skills actually are?
Well, communication is the most important thing. You have to be really willing to listen to people who, for them, this is a really big thing. You know, you have to be willing to listen to their complaints, especially throughout their treatment program, because that's one of the hardest things we have to do is to get them through and enough treatments so they don't stop where they will get the results. So we have that all the time. That's the biggest problem with patients. And since I have ever been in practice, it's to be very calm and patient with the patient and listening to them and just encouraging them and telling them the truth. You know,
Mhm.
people will come in and they have a problem for like 10 years and they expect, oh, you know, since they've been to medical doctors, you're going to give me a shot or you're going to do something that I'm going to be better tomorrow. That's not how the body works. For instance, we have people come in, we tell them at the beginning, we're going to move your atlas back to where it's supposed to be. But you will feel stiffness in the neck. You feel changes in your body. You know, you may feel really good right after. You could feel worse the next week because as the body heals, it will cause inflammation to heal the different areas. You know, sometimes it'll be in one area, and as it's done its job in that area, it'll go to another area and start healing there, but then you feel in pain there. So as we know that as long as the atlas is in its proper place, then the body will heal itself. So it doesn't matter what technique you use. That's the most important thing, is to have the patience and encourage the patients and to know your anatomy and physiology really well. So you could explain to the patients that who don't really understand that. They're not as trained as you are. they go on the internet or something, but that doesn't make them a doctor.
Well, a lot of it is sometimes I try to tell my interns that I have from high school, college, or even chiropractic school, a lot of it is, okay, how do we find out where the communication level is, what words they're using to describe their pains, for example, and then get them to slowly get bridge over to more of a medical terminology over time so they understand it is a condition that needs professional treatment, and then you're there for them with experience and time like we have to get a knowledge to get to communicate with confidence. This is going to be what's going on. Be transparent with what they may not feel, and what the process will get them in the length of time, so your body can change physiologically to better health state and maintain that.
Correct. Also, I mean, when you're first out of school and you haven't had like a practice where you're seeing a lot of patients,
Yeah.
and you get all different types of patients and
Mhm.
the ability to heal and things like that. They really have to go by someone like you who've been in practice and know that this is going to happen. You know, you're
Mhm.
not going to have every patient say, "Oh, you're the greatest doctor in the world," and you know, I feel great after 2 or 3 treatments. It's not reality.
Mhm.
So it's very important for the interns who are. It doesn't matter what technique it is, that this is what occurs. And you don't know what the patient's doing when they go home.
No.
I used to have patients say, doctor, I don't know. I was feeling great on Friday, and now it's Monday, and now my back pain is gone. And this was when I was practicing the diversified technique. And I said, well, did you do anything? No, I didn't do anything. No, I didn't do anything. And then like 5 minutes later said, I did do gardening for like 14 hours on Saturday. Could that have done anything?
Where I built a block wall. It was a long weekend, holiday weekend. I built a block wall. I have a desk job, so that can't cause any problems, right? No, of course it can.
Exactly.
I think sometimes they're unrealistic. The delayed reaction. Also, if I did it on Sunday, why do it hurt Monday? So I guess by, like you mentioned, by being transparent, this is what you can feel. This is what's going on. Watch out for this. It gives them the bigger picture. Hey, any questions? This is the doctor to go to make sure I'm doing the right things through my care to get the most value out of my treatment while I'm here.
Yes, and with the younger doctors with experience, they'll learn all that. I mean, I have so many patients who come to me who are going to chiropractors, but they couldn't fix the one thing they came for, but they love their chiropractors, and they say, can I still go back to my old chiropractor? And I said, yeah, as long as they're not touching your neck, let them do whatever you want them to do. I mean, it's fine.
Good. My most important question for you, Doc, too, being New Jersey, are you a Jets fan or Eagles fan?
Jets. Actually, Giants, but
Giants. tough over there. I'm a Pittsburgh fan, but I'm on the West Coast, so it's life. What do you do?
Yeah.
Anything else for your first show with us, Doc? We have all information on the post notes for one too. EPICSeagirt.com is your website for one. And Seagirt is a city?
Yeah, it's a town. It's it's not big enough to be a city. We're in the New Jersey shore, where we're right by the ocean. So it's a place where everybody in New Jersey comes down during the summer, from northern New Jersey or Philadelphia. So what I did want to, if anybody, any of your listeners are interested in asking questions, they can go to www.goepicclinic.co, and they could get a free consultation, phone consultation.
Put the show notes right now while I'm with you. At that point, I'll put in the show notes so people have that. So it's, let me see here. So it's
www.goepicclinic.com. .co, not .com.
Epic Clinic. Clinic.go. Got it. Done. Doc, phenomenal work. I love your experience. I love your knowledge. I love the technique for one too. It makes life simple. Like you even incorporate, if you have a practice now, incorporate your practice to be more efficient with patients, right? All of us as chiropractors, healthcare professionals, we want our patients to get better. We want success stories. We want them to tell their friends because we want to make sure people understand it's not just medication based, not surgery based. Can we get people better without that naturally, which is the body's meant to do?
Exactly.
All right, Doc. Hold on. I'm gonna take us off the show. And thank you guys for watching the show. Give me 1 second.
Okay. Thanks for having me on.
Welcome, of course.